I would like to welcome you to this virtual meeting of the Overview and Scrutiny Board. Can I remind all participants that normal rules of procedure apply? For example, comments and questions need to be directed through the chair. As we are meeting virtually, proceedings may take slightly longer, so your patience is appreciated. As per our virtual meeting procedures, questions have been received prior to the meeting, and I will call on the relevant member at the appropriate time to raise their question. When you are invited to speak, please state your name. While members of the public can view this meeting via YouTube live, they will not be able to actively participate or comment on proceedings. As this meeting is being live streamed, can I remind all participants that their conduct should reflect this? The board is going to meet regularly, and COVID-19 will remain on the agenda. The Mayor will be invited to attend all future meetings of the Overview and Scrutiny Board. I'd like to go to the agenda now, and I'd just like to say we've got members of the Children's Social Care Scrutiny Panel joining us today, as we are receiving an update report covering the work of their service area. So, any apologies for absence?
Yes, Chair. We've got apologies from Councillor Lee Garvey and Councillor Tom Morstan. Thank you, Chair.
Thank you. Got any declarations of interest? No. The minutes of the OSB held on the 12th of March 2020. Can I just say that Andy Preston was at that meeting, but his attendance hasn't been recorded. So with that amendment, are people happy to agree the minutes? Thank you. Right, can we go on to agenda item 4, the Executive Forward Work Programme. I'll pass that over to you, Caroline.
Thank you, Chair. Obviously, this is a standard item on our OSB agenda, and it just gives members of the board the opportunity to have a look at what's coming up on the Forward Work Programme. If any members have got any questions on this item, I'm happy to take those back and relay them to the relevant parties.
Any questions? No. Move on to agenda item 5. We've got 3 speakers today to cover the coronavirus, COVID-19 local authority NHS response. And that's Tony Parkinson, Chief Executive, Eric Scully, Director of Adult Social Care and Health Integration, and Mark Adams, who's Director of Public Health. Can I just say that we will listen to the presentation by them, and then I will bring members in who will submit the questions. So I'll hand it over to you, 3.
Thank you, Chair. It's Tony. I'm not so sure how you've had the report. Do you want me to go through it in any detail, or are you happy for me to just share the highlights and move into questions?
If you can just share the highlights, Tony, and move questions, please.
Okay, thanks, Chair. So what we've provided you is version 7 of the recovery plan. There will be a more recent version following a recovery group meeting this afternoon, which finished about 15 minutes before this one, but it hasn't changed substantially. So this is the document really that kind of sets out the next stage of our response to the COVID-19 pandemic. We've dealt with the emergency and responded by putting in place shielding hubs and getting business grants out and being able to undertake risk plans on children and all those sorts of things that we were expected to maintain PPE in care homes. This is about, as we step out of that emergency, but we need to deal with the impact of that it's created. What do we do to rebuild, restore, and rehabilitate both our communities and our businesses? So what are we going to do about the impact on people's lives, and what are we going to do about the impact on business? And this follows a kind of prescribed government model. The way that we've done that is we've ended up with a number of work streams, and those work streams are health and wellbeing, which are led by Eric Scully and Mark Adams. So that's how do we deal the impact on the community's health and wellbeing. Children's Care, which is Catherine Parry, who's the interim Director of Children's Care, looking at the impact on children and families on the children's services provider market, and also on our Ofsted improvement plan. Undoubtedly, had COVID not come along, we would have had much more wider council involvement in the children's services improvement plan. That hasn't happened through the last 2 months, so it's kind of how do we catch up? Adult social care is Eric, so that's looking at the impact on those vulnerable adults who receive services. Again, the impact on the market, and there's a lot of chatter about the impact on the market at the moment, and to the model of delivery of services, because we don't necessarily always want to return to the world that we had pre-COVID. You know, we might want to try and retain some of the volunteering, for example, that we've seen around social engagement of people who might be exposed to loneliness. Education and skills is Rob Brown, and that's looking at the impact on school-aged children, which, as I'm sure you can appreciate, may well be significant. So, do children transitioning from primary to secondary school need more support than they normally would? What is the potential impact on those who are due to take examinations next year or the year after on of missing so much schooling time, for example? What, if any, has been the impact on those vulnerable children within an education, health and care plan, and also on children potentially at risk of exclusion from schools? So that we'll look at that. In terms of play, we'll look at environment and the infrastructure. So that's, you know, the material kind of infrastructure that we have, parks, playgrounds, you know, all areas where we maintain land and road infrastructure and such like, and Jeff Field is leading that. Town centre is a specific area that we're looking at because of the potentially significant impact on retail from the COVID pandemic, and also on our plans for the town centre. And then business and economy are the wider business employment around the town, and our housing and construction industries and plans. And then under business, we've got council services and priorities. So that will look at how our strategic priorities may need to change in light of COVID, the finances of the council, and also our operating model as a council. And as an example of that, pre-COVID, we had about 370 staff remotely logging onto systems at any one point in time. Currently, we're averaging 12 to 1300 staff. And the question there is, what is the new normal? You know, in the push for agile working, was 370 the right figure, or does it lie somewhere between 370 and 1300? And where should that figure actually be, and what do we need to do to get to it? And they're supported by 3 work streams. Legal, headed by Charlotte Benjamin. That's about making sure that we're fulfilling our legal responsibilities. Finance, which is about making sure that we're aware of the costs. And communications, which Andrew Glover leads, which is about making sure that we are communicating these changes within the council and out with the council to our communities and our businesses. Each of those have got a developing terms of reference that looks at all of the issues that surround that particular work stream, and within that particular work stream, they will look at the purpose of that group. So what is that group aiming to deliver in terms of recovery? The principles, so the principles that it will apply to addressing those issues. Who should be a member of that group? And you'll see some of them, you know, I've got very large groups, and that'll be reflective of the amount of external involvement that we need. And then key lines of inquiry, and the key lines of inquiry are really the things that will inform the action plans that sit alongside each of the terms of reference for the groups. So, for example, if we just choose one at random, if we look at the public health work stream, then it will be looking at how we can identify and address inequalities that have arisen or broadened as a result of COVID-19. We will look at advice required across subgroups to ensure those inequalities are reduced. How can we support communities to regain or enhance physical and emotional well-being? Consider what new ways of work we want to amplify to develop new normal. Explore the impact of lockdown and the response to COVID-19 on community safety, and develop plans to rebuild community safety and to increase cohesion within those communities. and then to assess the effectiveness of the recovery effort, building learning on community wellbeing through embedded research. I think it's fair to say we've had 4 or 5 meetings of this group. This is still a very early draft, although I'm very keen that we step into delivery as soon as possible. The intention is that we will present the report to executive on the 16th of June, and from that point in time, we'll basically get on with delivering the recovery effort alongside our ongoing response to the pandemic. So that I think that hopefully that's a quick fly through, but obviously happy to answer any questions.
Thank you for that. The first question, we've got 2 questions, and that's from Councillor Story. The 2 questions, can I ask you to ask the first one, then get the answer, and then ask the second one? That's all right?
Yeah, thanks, Chair. That's fine. Yeah. Okay, so the Secretary of State for Local Government said at the MHCLG Select Committee that he didn't have faith in the modelling that councils were presenting in terms of the indirect costs of COVID-19. And I wanted to know, what modelling are we doing in terms of those indirect costs, and how are we calculating the income and revenue we expect to lose, bearing in mind the financial pressures that COVID's going to present to the council? Thanks,
Matt. So we receive a weekly update at our Gold COVID-19 meeting, which basically breaks down our assessment of the financial impact into 4 areas. The first of those areas is the direct cost, which is pretty easy to calculate. So that is, how much has it cost us to deal with the immediate pandemic? And that will include things like additional payments to care homes, for example, payment of business support grants. So that's quite easy because we know what we're spending, and we know, for example, with care homes, the time that we think we will continue to pay that. So far, we've been provided £9 million outside of the business funding that we've been provided. We're comfortable at this point in time that that funding will be sufficient to deal with those particular aspects. Aligned to that, we then look at the cost of recovery, which is something, because our recovery plan isn't yet fully developed, we couldn't calculate a figure, and I think it would be wrong to calculate a figure on that at the moment. But as these plans develop, once our action plan's in place and we can make a proper assessment of the likely cost, we can then start to factor those in. The third area that we're looking at is the impact on our savings plans. So all of our directors have been away, looked at the savings that have been approved, and looked at whether or not there will be an impact on the delivery of those, either because directors or other staff have been dragged away onto other work. Dealing with the pandemic, it's basically an emergency planning situation. So I've not been able to deliver those savings, or whether reviews and such like just can't take place, or income can't be generated. So we've got an assessment of that. And then the final area that we're looking at is our lost income. And what we're doing with lost income is we've asked each director to look at the ongoing impact of COVID on things like the farm, museums, town hall. So we can look there at income that we previously collected and income that we're now not, and therefore what we're not collecting. And what we're also trying to get a handle on, which is probably the most difficult, is the impact on our council tax. So the impact on our council tax is likely to be twofold. So the first will be a rise in the level of unpaid council tax bill, so the rise in the level of debt. There is some national kind of noise on that, but I think every area is so different. You can't kind of go by any average figure across all of England, because Middlesbrough is a very different place to that average. But we're also trying to assess what the impact will be on the future growth that we've anticipated in house building. So for the last 5 years, we've managed to hit our house building target in terms of growing our council tax base. What we don't know is what this pandemic will do in terms of its impact on future house building rates. So we've written to Simon Clarke, and we've made representation to government on the basis that there are 4 areas of financial impact that need to be considered, and that undoubtedly what has been provided so far will not be enough. The further consideration that we've asked of is that that's okay dealing with the immediate impact now, but actually, it's very likely that in the medium to long term, in terms of finances, we need a fundamental review of the funding mechanism for local government, that recognises much more significantly need than currently does, because we're not sure what level of, for example, of hidden harm is existing with our communities that's going to play through as additional demand. So if there is a lot of domestic violence going on at the moment that is not being reported because of lockdown and all the rest of it, once we come out of that, we're likely to see a significant demand growth in children's services. So we've had discussions on the principle. Those discussions have been okay. Nothing's been kicked back. But in terms of an actual amount, we haven't quoted figures yet, quite deliberately, because I think anybody who tries to quote a figure now will be quoting a figure that wouldn't stand up to a test. So we've not done that. We've got a figure internally, but it's not a figure we've quoted externally.
Matt, would you like to come back on that?
Just very briefly, I think I'm totally in agreement. Obviously, we've been singing that tune about rejigging the way we fund local government in terms of taking account of deprivation for the last 10 years. So, I mean, absolutely on board with that. But I think I guess, are you saying there's an expectation that in terms of those 4 strands, you will be drawing together a wider cost implication at some point further down the line, and then that'll form basis of a further submission to government?
Yes. So what the government have said so far, Matt, is that they are happy to reimburse all reasonable costs associated with the response to COVID. So in terms of the direct cost, I'm confident that they will be reimbursed. In terms of lost income, I expect that there will be a discussion and a negotiation on that. Savings haven't been referenced, and I expect the government will say that's your problem, if I'm honest. And our estimate is that, you know, that's likely to be in the region of £2 million for us. And likewise, the impact on our financial planning in terms of a reduction in housing and house building rates, and any potential impact on our capital programme because of lands being devalued as a result, is a discussion that we will need to have. But that's definitely a representation we will make to government.
Right, thank you. Matt, do you want to ask your second question?
Yeah, thanks. Yeah. Just about the subgroups in terms of the recovery strategy, I was wondering if this was going to be a cross-party approach and whether political groups would be invited to send a representative. As leader of the largest group on the council, obviously, I'd be quite keen for our Labour councillors to have an input onto that. And I was wondering if that was a possibility, something that could be considered.
Okay, thanks, Matt. So, I mean, I think that's probably more a question for the Mayor than the Chief Executive, but I have discussed it with the Mayor. He's quite clear that it's an executive function and that membership of the groups politically should be executive members with appropriate involvement through the scrutiny process as outlined in the report. What I would suggest is that if you want to discuss that further, obviously, it's something that you take up with the Mayor.
Councillor Story, do you want to come back on that?
Yeah, thanks. Yeah, that's fine. Thank you.
Right, thank you. Right, next question is for Councillor Halawi. You have got 2 questions. Do you want to ask your 2 questions? Your mic's not on. Your mic's not on, Alva.
Quite right. It's about the data that we need desperately about the COVID crisis in terms of particularly the R factor, which pertains to specific areas in the town very clearly, because we're trying to make decisions within the town, within specific areas, and we need more precise information to be constantly updated to help us make informed decisions. So, for example, schools would be an example of where we need very precise data related to the local area. Are we likely to have such precise, updated and specific information?
Okay, I'll ask Mark Adams to respond on that one, Councillor Halawi.
Okay, thank you. We do have various data sets that all say something slightly different with slightly different definitions within them, and we can certainly share what we've got. We've got some that's at a lower sort of output area from the Office for National Statistics. We've got some details by ward on primary care, from primary care diagnosis, so they're not necessarily tested positive, but clinically diagnosed as positive. And we've got some data by postcode on inpatients from James Cook, so we can share those details with the board after this meeting. I mean, the only sort of health warning on it really is that the more you cut things down, the smaller the numbers get, and the less inferences that you can draw from them. But I am meeting with head teachers next week to talk through some of the data to inform some of their planning. So it is being played into some of the planning, but we can share that through Caroline after this meeting.
Do you want to come back on that one, Councillor Al-Mahawi?
Yes, please. It's just, for example, there are some areas that we're all concerned about where the data nationally is pointing out vulnerabilities within specific communities, such as the BAME community and other more deprived communities. And I think it's crucial that we try to focus in on the data there, because we need to draw conclusions and make decisions about how we move forward in supporting some of the more vulnerable communities with higher statistics, more worrying information.
Yeah, so the information that we've got, particularly on our BAME community, is that and the only details we've got here is on inpatient details, is that the proportions as inpatients are reflective of the population, the BAME population, and the mortality rate is considerably lower than the average mortality rate. So we're not seeing the same with our local population that we've seen some of the reports that I think you're probably referring to in terms of the bigger impact on BAME communities, which I think is probably reflective of the lower age demographic of our BAME community. So we are definitely seeing that the vulnerable communities are basically older people, BAME, men, particularly those in ICU, obesity, and pre-existing conditions, particularly respiratory and renal conditions. And as I said before, the more you cut down the data on an individual local authority area, you get smaller and smaller numbers. So a lot of that analysis will have to be done on a bigger footprint, such that the numbers are big enough to actually draw conclusions from it. But specifically in terms of BAME, we're not seeing the same impact that has been seen from national and international research, but we'll keep an eye on it as this pandemic progresses.
Councillor Al-Mahawi, do you want to come back on that?
I'm just really grateful if this information could be shared regularly with councillors, so that we can keep a watchful eye on specific areas for which we're responsible and think about decision making in terms of that data and the way we move forward.
Yeah, we'll share what we can. Some of the data we've got from James Cook is on because it hasn't been through the sort of usual processes in terms of coding and assurances. They're a little bit wary of sharing it. It's sufficient for what I've shared with you. So we'll share what we can with you. So it's not for any lack of wanting to share it, but some data we've got from other partners that we need to be respectful of their concerns over the quality of the data. I think it's the quality sufficient for what I've briefed in terms of the BAME community, because those details are sufficient, but they're a little bit nervous of some of the other bits of the data. But we'll look at what we can share with them, and where we can, we'll share it.
Thank you. Thank you, Chair.
Story, I think you've got another question on the public health, and one of them is related to the BAME community. Do you want to ask your two separate questions and then get an answer from each?
Yeah. I'll actually covered some of it. But what I would be quite interested to hear from Mark about is, I mean, I've been contacted in my ward, particularly by charities who support asylum seekers and also the BME community more widely. And one of the concerns they have is the community cohesion aspect of this, that a lot of BME people in my ward feel intimidated and threatened sometimes on the basis that they're seen as carriers, or that they're more likely to be carrying the disease. And that's causing a lot of distress for people in the ward who obviously haven't got COVID, but because of their ethnicity, there's a perception that they may be more likely to catch the disease. Now, if you're saying that there's some evidence to suggest that perhaps we're not seeing the same trends in Middlesbrough as we are across the UK, I think disseminating that information as best we can to the wider community will be beneficial, because of community cohesion issues that we're facing.
Yeah, thank you. And we did talk in recovery group previously about developing our local communication strategy further to get some messages out about how people can support each other in the community. And certainly, if there are things in the community around BME populations being more susceptible or transmitting. That's not true either. It's more that the impact nationally on that community is greater than it is on the non-BME community. It's not because they're more likely to pass the disease on or to get the disease in the first place, I don't think. So just in terms of working with that community, we do have Shada Khan and Idris Rashid on the recovery group, and we're also working with a number of VCS groups, the BME network, the Investing in People and Culture, and Tees Valley Muslim Council. So we will be developing our networks with some of those groups to understand how we ensure that whatever communications are going out are understood within those communities, and whatever they need to do to protect themselves, they're adhered to. So it is on our agenda through that recovery group, and as I say, in terms of the communication strategy, we'll ensure that we build some of those messages in to keep communities protected from other threats that are linked to COVID, but not necessarily specific directly as a result of COVID.
So sorry, do you want to come back in on that one, or do you want to ask?
I'd just like to thank Mark for that. What I might do, Mark, if you don't mind, could I possibly contact you outside this meeting with some of the people I've been talking to who might want to chat to you and Shada about what's going on in the recovery group. I think that the degree of reassurance that we can provide them with, I think it will be really beneficial if we can provide them with a bit more reassurance about the state of play, and that they can feel part of that process as well.
Yeah, sure. Yeah, I welcome that.
Okay. Thanks, Mark.
Councillor Story, do you want to ask your second question on public health? Yeah,
it was similar to Alma's first question as well. I mean, the one thing that I was wanting to ask about is mainly about the this idea of tailoring our response based on the R rate. So if we can get a figure in terms of our R rate for Middlesbrough, and if that is something that could be calculated, do we think it's desirable for us to have plans that are tailored to our particular needs in Middlesbrough? Obviously, we have communicated to TS3 in regards of their high infection rate. The park closures did deviate from other local authorities in terms of what they were doing. So we have sometimes deviated from the wider sort of area in terms of what we're doing in Middlesbrough. And I just wondered if we need to be taking account of those differentials in our response to COVID-19.
I think just in terms of the R rate, I think nationally there's a lot of conversation about the R rate. It's a very difficult number to calculate. I think, unfortunately, because it is just a number, it looks like it might be something potentially simple to calculate, but it comes from multiple data sets across cases, hospitalizations, deaths, and also there's more sort of statistical uncertainty because it covers different time periods as well, because people are infectious for several days. So it's actually very complicated to calculate. The only sort of granularity we've got on it at the moment is to a regional level, which you'll have seen that the North East has got the highest R rate in the region. It's twice that for London. I think we know all of the kind of numbers that feed into the R rate, and I think part of what we were talking about the communication strategy, I think that we need to bear in mind our population may well be different to the national population in terms of easing lockdown, and we just need to make sure that we build in the science into our local response such that we keep people as safe as we possibly can.
Come back on that, Councillor Story.
Yeah, that's fine. I mean, I just think as long as we're taking account, I mean, I'm sure you are. I mean, you guys are the professionals, but I think it's just as long as we're taking account of the fact that, you know, London's R rate might be 0.4, but then we're sort of probably at least 2 or 3 weeks behind London in terms of the progression of the virus. So I'm sure that we are taking account of those things, but I think you've answered the question there about making sure that the science applies to Middlesbrough in the appropriate way. So thanks for that answer.
Thanks. The next question is from myself, Councillor Janet Thompson. There's an accusation that people have been moved out of hospital back into care homes with COVID-19. Has that been the case in Middlesbrough?
Eric Scholar is going to respond to this, Chair.
Yes, I'll come in on that, Chair. I think what we need to do is think about the chronology of the outbreak. So when COVID-19 started to become an increasing issue from Middlesbrough, as it did in lots of areas, there was very clear guidance given from government, from NHS, about the responsibilities on adult social care to provide support around that. And one of the two very clear priorities that we were given was to make sure that we were able to facilitate hospital discharge, because this was happening at a time when we anticipated the real danger of hospitals being overwhelmed by the increase in the infection, and ICU being overwhelmed. So the priority was about making arrangements to have people discharged from hospital, and we did a number of things to do that. One of those was block bookings from residential care beds. We had to respond to discharge requests within around about three hours. Now, what we need to remember is that at that point in time, there wasn't routine testing of individuals on discharge from hospital. The decisions made around discharge were based on the actual clinical presenting need, taking them into hospital, and the consideration around COVID was based on whether or not they appeared to be symptomatic or not. So on the back of that, what was being put in place was arrangements to isolate people once they were discharged from care homes. So within those cohorts of individuals coming out of hospital, it's pretty much certain from my perspective that there were individuals who were being discharged who were COVID positive. Now, the accompanying guidance around this time was also saying that in facilitating hospital discharge, it is not unacceptable to discharge someone who is COVID positive from hospital into a care home. That the infection prevention and control information that was being furnished to care home providers was that with the correct barrier procedures and isolation in place, there shouldn't be an unacceptably high level of risk associated with doing that, and people can form their own opinion on whether that's been borne out or not. As we progressed through the outbreak, then they became a routine process of testing people for COVID at the point of hospital discharge. But what we have actually seen is some individuals testing negative, then having subsequent tests and testing positive, because we know that there's a sort of 20 to 30%, I think is the figure that's talked about, false negative risk within the testing. So we've had people who've been tested negative, discharged into care homes and have turned out to be positive. And we also have, as you say, had individuals who have had a COVID positive status and have been discharged from hospital into those care homes in the knowledge of the care home providers themselves. Most of the people coming out of hospital and going into care homes have not been people new to care homes. In most instances, they've been people who have lived in those care homes already and have been returning to those homes. So as far as your question goes, yes, there have been people who have been COVID positive who have been discharged into care homes.
Thank you for that. Our next question is again from me. What role have the council's public health team played in the epidemic? Is there potential for an increased role, like testing and tracking? Would it not go out to source? Would we do it in-house?
Mark will respond on this, Chair.
The public health team have been working, I guess initially just interpreting national guidance, liaising with Public Health England and regional directors of public health. The main focus of that initially was around the approach to testing, liaising with NHS colleagues to understand local capacity and use local capacity over the national system. Didn't have a fast enough turnaround of results and didn't feed back into the local system, still doesn't feed back into the local system, but they are working on that. And also, as Eric's already referred to, using the tests to get people back into work when there was around about a 30% false negative. So potentially you're bringing people that have tested negative but might still have COVID back into the workplace. So we were able to get local arrangements on that to reduce the risk of people that were infectious coming back into the workplace, particularly in the care home setting, to infect other people. We've also looked at, we've been working with Eric, supporting the development of the approach to supporting care homes, which is now morphed into the national requirement for the care home management plan across infection prevention control, PPE, testing, and pulling together the NHS clinical support that's an offer to care homes to support them during the COVID pandemic. We've also been supporting the hub, particularly the delivery of prescriptions, and putting in place a system to get prescriptions delivered to people that needed them that couldn't get out because they were isolating. That's now been handed over to the NHS Good Sam. process. And then finally, supporting the services that we directly commission or directly provide across substance misuse, sexual health, health visiting and others, to shift their provision to a sort of risk assess online, telephone, or and where necessary face-to-face offer to ensure that the vulnerable people that we support, we could ensure that that support was maintained to them as much as possible. In terms of the second part of your question, I think that the testing and tracking that you refer to and the contact tracing, it's looking very likely now that that's going to be a sort of national and local effort with greater local leadership than we've seen in some of the other areas, although we fought to try to get local leadership. So there's a 3-level approach to the national programme. Level 3 is call handlers, which will be recruited and are being recruited nationally to ring contacts of people that have been tested positive for COVID. Level 2 is being recruited through NHS professionals, which are 3,000 contact tracers being recruited nationally. And where we'll be involved is in the Level 1, working with the health protection team at Public Health England on planning for outbreak and developing our local outbreak management plan for managing and controlling outbreaks where they exist, and dealing with complex situations. So there was a question about houses of multiple occupancy. There would be one potential area of risk, working with schools and other settings, and just understanding how locally we can support where we've got defined outbreaks or defined hotspots as a result of the intelligence from the contact tracing. And I guess locally, where there's going to be issues of potentially people having been contact traced, having to come out of the workplace, we're in a better position to support if that becomes an issue on a business or a council service or whatever it happens to be, or a school staying open. So we're much better placed to support that than a national organisation that's very remote from Middlesbrough.
Thank you for that. We'll go on to the next one, which is from Councillor Cook. You've got 3 questions, Councillor Cook. Do you want to ask one at a time and then get the answer?
Okay, thank you. I'm incredibly concerned about those in shared housing or HMOs being able to stay isolated whilst sharing facilities, which seems impossible. Is there any guidance on what the owners of these properties should do, and how can we ensure that they're safeguarding their tenants?
So Eric's got to try and respond to this one, Councillor Cook.
Yeah, it's really interesting. When I saw the question, Councillor, I went and I had a look at the government guidance, and it appears to be one of those issues where the guidance isn't really terribly helpful. It does appear that the government guidance kind of invites you to consider a house in multiple occupancy just as it would any other house, and consider the occupants of it pretty much like a family, and it seems to be that you get directed to look at the social distancing guidance on the website just as you would for a regular family. So that doesn't seem, the principles apply, but it doesn't seem terribly helpful. I know that some bodies, landlords bodies, based Landlords Association, I know that Shelter and a number of organisations have put advice out on this. But I don't think it really bottoms it out terribly well. And I guess the guidance on social distancing that's there will work for some houses in multiple occupancy and less well for others, because it will cover a wide kind of set of scenarios. I also see in the media there are questions about the extent to which landlords might potentially be liable to litigation afterwards if they can be seen to have fallen down in their responsibilities in some way, their responsibilities on kind of health and safety fronts and whatnot. So I think at the moment, I think the guidance isn't great on it. I think there are some landlords associations that have provided some information and support for landlords, and there are kind of suggested practices that they can put in place. But actually, I don't think at the moment there is a terribly good answer if you do have people who don't want to consider themselves part of a kind of family, in inverted commas, and they're in a position of having to share facilities. If there are people, I think, who are rendered vulnerable and are rendered frightened because of that, then I think we probably have to go away and have a bit of a think about how we would wish to respond to those individuals, because if people are being rendered vulnerable because of this, then I would like to think we can find a way of intervening. So I know that's not a comprehensive answer to the question, but actually it's one that we need to go away and look at, Councillor.
Chair, if I could just add to that response, if that's okay. What I will do, Councillor Cook, is there's a an LA12 group, so that's the 12 regional chief executives, and that links in nationally. So I'll raise that question national. I'll raise that question through that group nationally, or that issue.
Okay, thank you. Because I think probably one of the difficult things is the shared housing isn't actually registered, as far as I understand. So we probably don't have an accurate map of where they all are to be able to check to see if the occupants are okay, sort of acting as a family, as it were, or if there are problems. I don't even know if there's an easy way to check other than maybe council tax records, but even that would be difficult.
Yeah, I'm
Just-
not sure.
Anyone want to answer that?
I don't know. We'll need to go away and have a look at that.
Right. Can we take your second question then, Chris Cook?
So my second question is, what impact has COVID-19 had on those accessing services, such as substance abuse services, and what provision will be needed to help people re-engage with those services?
So this is Mark.
Yeah, thank you. I'll pick that up. So we've worked really hard with the Substance Misuse Service and Middlesbrough Recovering Together, which is a model jointly delivered by CGL Foundations and Recovery Connections. And we know that substance misuse clients often have serious health conditions such as chronic obstructive pulmonary disease. So they're often in the extremely vulnerable group and should be shielding. So we've done everything that we can to support that. They're working, Middlesbrough Recovering Together, working with Medics UK and Helpborough to facilitate the home delivery of medication, safe storage boxes for those who are medically high risk of infection, vulnerable or self-isolating. We're also shifted to consultations over the phone and over the internet where possible, and face-to-face if that's not possible. So we're mindful that this is a potentially difficult client group, and we don't want to exclude anybody because they don't have access to particular bits of technology. And then Middlesbrough Recovering Together have developed a whole raft of resources, including a YouTube channel with a whole raft of videos to support people in their recovery journeys, distraction isolation packs around getting things to people to support themselves and distract themselves and do things other than focus on their drug habits. So we've got packs that cover social networks, trigger, mindfulness, 5 ways to well-being, and building resilience and various other things. There's a Facebook group as well to build that sort of peer support across this group. Food delivery scheme from Fork in the Road, recovery support, including sing-along sessions, virtual yoga and support groups. So there's a whole raft of support that's been put in discussion with service users and with the Middlesbrough Recovering Together. So I guess part of this will be determining what the new normal looks like as we move forward. But we're incredibly mindful that this is a very vulnerable population, and we need to do everything that we possibly can to ensure that we can engage with as many as we possibly can to support them in their recovery journey. So I hope that outlines the sort of steps that we've taken in consultation with service users to ensure that the service remains accessible.
You want to come back on that, Chris?
Yeah, I really like that answer because it sort of reaffirms what I was hoping would happen, that we are trying to keep that contact alive, because that's probably the most difficult thing, is getting contact to initialize. So to lose that would be a massive step backwards. And my last question is, when identifying and engaging with communities, how will we ensure that none are missed? And I know that Mark did cover this quite well, but if I have any others, any communities I identify, am I able to, like Matt, bring them to yourself or Shadow and try and do it that way?
Yeah, I think if you want to pass them through to me, Councillor Cook, and we'll make sure that that's included when we're looking at each of the recovery groups that we've got.
Are you happy with that, Chris? Right, can we move on? The next question is from Councillor Story about transport and infrastructure.
Thanks, Chair. Yeah, I just wanted to talk about the government's announcement for extra funding for transport and infrastructure. I understand it's going to be distributed through the TVCA, and I was wondering, how do we access the money, and will we be bidding for this funding? I also wanted to ask if we will be looking at wide-ranging and expansive changes, because one of the things that's going to come out of COVID, obviously, is there's going to be significant behavioural change in how people get around? And will we be looking at things like targeted road closures, priority for public transport and pedestrians, and making sure that the public health impacts and air quality impacts are as positive as they can be as we come out of the coronavirus crisis?
Councillor Story, absolutely, I agree with everything you've said there. Absolutely, you know, they are all factors in the new normal that we would want to create as we kind of step into and come out of recovery. In terms of the funding that's been provided to TVCA, we've not had anything from them yet, so I suspect they're still formulating that. I have contacted Julie Gillespie, having had foresight of the questions, to ask where we were at. I haven't had a response yet. But obviously, I'm more than happy to share that response once I receive it.
Do you want to come back, Councillor Story, on that one? Or?
Yeah, I mean, just to say that, you know, it's my view that anything we do needs to be expansive. I think I don't want us to be tinkering around the edges. You know, if we can really look to kind of embed significant behavioural change in terms of public transport and the way people move around and access the centre and our communities, I think that could be really, really positive for our communities. And if the government's providing this funding, we should be looking at the biggest possible programme of change that we can.
I absolutely agree.
All right, can we go on to your next question, Councillor Story?
Yeah, thanks, Chair. I just wondering what assessment's being made in terms of housing and the impact that it's going to have on the medium-term financial plan. I know that's something you've already addressed slightly, but obviously private developers are going to be less to want to invest in developed sites around Middlesbrough. And will we be looking at an expanded role for the Middlesbrough's housing development company to get them involved more to prime sites that perhaps the private sector aren't as keen on? And what do we expect that the impact might be on the income to the council?
Thanks, Matt. So there's a piece of work ongoing at the moment that's been led by James Bromley with Richard Horniman that's looking at this. So as I alluded to earlier on, you know, there is significant potential for our plans on growth in council tax base to be hit hard by a slowdown in housing, and to kind of get a double whammy on that, because sites become devalued and therefore we don't get the level of capital receipt in that we thought we originally projected, and that then impacts on our capital programme, which then impacts on our economic regeneration programme. So there is absolutely a significant risk of that. So that work is going on at the moment, and I'm due to get something next Thursday on that. It's coming to the corporate management team meeting. In terms of MDC, I think absolutely. I think one of the likelihoods is that there will be a greater call and a greater push from government for social housing, and I see MDC as being a central part of that. So quite how that works, I don't know. Whether MDC, you know, actually ends up owning and taking in a rental income from properties, or builds and sells, or, you know, gap funds. I think I wouldn't rule anything out at this point in time. What we will be doing as we start to understand this more is to understand what model will work on each of the sites that we've got, and then we'll try and put that into effect. That kind of don't quite know enough yet to really respond any further than that.
Do you want to come back on that, Councillor Story?
Yeah, that's fine. Thanks, Tony. I hopefully, I mean, I'm a member of the Generation Scrutiny panel. Hopefully, you know, through Councillor Saunders' panel, if we can maybe look into that and provide some support and do a bit of some research and investigate aspects of that might be beneficial to developing a strategy around the housing as it goes forward.
I'm certainly more than happy for any element of the work streams that we've got, in full or in part, to go through the various scrutiny panels. I would welcome that. You know, I'm not suggesting we know all the answers. We don't even know all the questions yet.
Thanks, Chair.
All right, that's all the questions that's been received on the COVID-19. If anyone else has any questions, particularly on the COVID-19, if they would like to ask, then if they'd like to raise their hand, and I will get to them. Right, we'll take Councillor Halawi.
Thank you, Chair. It's a question about the homeless people in our town. Have we had a clear strategy for dealing with the position that they've found themselves in? And what will we do at the end of COVID, when we get to the end of it, in terms of further support for the people who haven't got permanent addresses?
Eric, are you best placed to respond?
Yeah, I'll come on that. I mean, we took a very clear stance at the beginning of the outbreak that we would seek to accommodate people in short-term accommodation and temporary accommodation, irrespective of whether or not I'm talking about individuals who present as homeless, irrespective of whether or not in normal times we would have considered them as eligible for short-term housing. So normally we would perhaps have sort of 25, 30 individuals in temporary accommodation. At one point, we were up about the 90 mark. And, you know, that was an expensive option to take, but it was absolutely the right thing to do. And alongside that, we arranged for meal provision. We, in some instances, provided people with cheap mobile phones because they didn't have any other mechanism of contacting us, and it was important for them because they were having to self-isolate. We also procured some individual accommodation so that people who were symptomatic and who had to self-isolate could do that, and they received meal deliveries there. So the situation has kind of moved on somewhat, and we're now talking to 13 about move-on accommodation and other providers for move-on accommodation for those individuals, because that will be the kind of the next challenge for us. But I think it's something that I think we should be proud of, that we took. When generous is the wrong word, I think it was a proper ethical stance that if our wardens, if our staff found people who were presenting as homeless, then we would accommodate those individuals. Otherwise, they would have been absolutely prey to this. There were some individuals, however, who we identified rough sleeping, who for whatever reason couldn't engage with temporary accommodation, and we did what we could to ensure that they were safe as well on the street and provide support to them. But that was a very, very small number of individuals, and they were all offered temporary accommodation.
Councillor Halawi, would you like to come back on that?
Yes, thank you. I'm very pleased to hear that. And I think that's the same in other areas as well, that people have been accommodated in hotels, bed and breakfasts, or wherever. I mean, there is a financial impact, which was an area of concern moving forward, to think, you know, how do we address this and how do we help and support people move on? But if we're engaging with the 13 housing group and they're on board with support, then I think that's a good way to look at it, and we'll move forward in that way. Thank you.
You're welcome.
Councillor Coop, have you got a question?
Yes, thank you, Chair. It was mentioned earlier on by Councillor Halal. The ONS issued some data which went down to ward level. They've only done this once. I wonder if this data is either available or going to be available again, because at that time you could look in my ward, but it's only been done the once. Is that data available either none from ONS or from any other source?
Mark?
Well, I think the frequency of this data is a bit frustrating because it's not. There isn't a sort of forward plan of we're going to release it every month or every fortnight or whatever it happens to be. So we'll pull together what we've got, and as data becomes available, we can share what's relevant as it becomes available. But it is very patchy and bits and pieces as and when it comes out at the moment. I think that'll probably change, but at the moment it's very patchy. But we'll share what we've got and we'll update it when it's relevant to do so.
Councillor Cook, would you like to come back on that?
Yes, thank you for that, because at the present time, if you look at various, it's still out there, it's way out of date. I understand that, but I think for all councillors, we need to have some fairly up-to-date information so know where we're plodding. Thank you.
Thank you. Any more questions on the COVID? Councillor Story?
Yeah, thanks, Chair. Just for Mark, I think I was just wondering. I raised in a briefing previously, but obviously once the cases of the virus start to tail off, are public health and local NHS providers preparing for the impact of non-COVID related health issues, in terms of the fact that lots of people haven't been presenting at GP surgeries or even presenting at hospital when they've had appointments, and the pressure that might be placed upon the NHS in terms of people then presenting with non-COVID related illnesses that perhaps have stacked up over the period of time where coronavirus has been more prevalent, and other preparations being made or sort of outreach work to encourage people to come forward and so forth.
The NHS is planning for what they're calling phase 2, which is around gearing up to more normal operations. And I think that the suppression of usual demand is one of the concerns of COVID. That I think in some of the excess death figures that you're seeing is some is COVID and some is people that haven't sought care or have sought care too late. So it is a significant issue, and we'll work with the NHS to ensure that where I guess specific communities need to be supported with some different communications or some different mechanisms to help them engage or to encourage them to engage, then we'll support with that.
Any more questions? Right, well, can I thank Tony, Eric and Mark for that presentation and answering them questions. You're welcome to stay or you're welcome to go, or if you want to say anything else on it.
I'll be staying until the end, Chair, to Tony. And I'm not sure if Councillor Jeanette Walker was trying to ask a question.
Councillor Walker.
Thank you. Hello, thank you, Chair. Yeah, I used the thingy to put my hand up, so I'll try not next time. I just wondered if I can ask Mark with Public Health, what about all the shielding groups? What's happening with them? Because there seem to be a lot of mixed messages, and some of my residents are asking me by message. They're in the shielding group. They've been sent text. Some people have been sent text to say they've got to shield longer. Some are saying that they haven't. Some have been told to get a case ready and have they signed a DNA. It's very confusing because some of these people feel very fearful at the moment. And now, of course, with more people going to be outside, I think, because they've been allowed a bit more freedom, which makes it more difficult for people who are in the shielding group to actually access outside safely. So what exactly is the message that I can convey to them, and also myself, because I'm in that group and I don't know what's going on, so I'm not getting any more. So can somebody tell us when?
I'll try and unpick what we have from the national guidance. I think you're right. I think it's a little bit confusing because the shielding group consists of very vulnerable and vulnerable. So there's two sort of subgroups within the shielding group based on clinical conditions and various other things. I'll get whatever guidance there is out after this meeting. And I think you're right about that it's a little bit like the suppressed demand for the NHS. People that are shielding and not getting out and losing functioning potentially by not exercising is another potentially hidden harm of COVID that we need to think about how we encourage that, because I think it's almost like the balance of risk, isn't it? The fear of going out and getting and catching COVID and that obviously having fatal consequences, which you can do quite safely if you're careful, versus the definite thing that's going to happen if you don't get out and you don't exercise and you sort of muscle tone and everything deteriorates, that will be a definite thing that will happen to you. So I think it's part probably, I think, of the local communications. We need to think a little bit more broadly about how we interpret some of the slightly confusing national messages to give something a little bit with a little bit more clarity locally to support our residents to stay safe.
Councillor Walker, would you come back to that?
Yeah, I appreciate that, because obviously these mixed messages cause people mental anguish as well. I mean, we already live with the fear that we're being classed as very vulnerable, and we've got to stay away, but we're being locked away for quite a few weeks now. And no, a lot of people who are in maybe flats, and also either high-rise flats or places with no garden access, it's not easy to keep contained within that without feeling mental anguish and feeling of being locked away and forgotten, really. And I think that's what's happening in a lot of these people. As I say, I'm one of them, so I can actually empathise with them totally. But I've spoken to a few of my residents, and they really are concerned that we've been forgotten about. All these things have been set up, and then okay, they're all right. They're locked away, so that needs to come out more. So please, anything you can do to help me deliver that message, sort of more proactively and positively, I think would be appreciated.
Thank you for that. Right, Councillor Higgins, is it on the COVID?
Yes, Chair. Send any information out Mr. Adams, could you please send it to all councillors? Because like Councillor Walker, I'm in that category, and I need to know when I can get out. So I think it would be useful for all councillors, because I'm sure they'll be getting asked questions by people who are still in.
Yeah, certainly we can do that.
Thank you.
All right, any more questions? All right. Well, once again, thank you very much to Eric, Mark and Tony. You're welcome to stay, but I understand if you want to leave. So I'll go on to the next agenda item, which is Children's Services Update. And we've got Sue Butcher, who's the Director of Children's Care. Can we just use the same procedure that Sue will give a brief overview presentation, and then the questions that's been submitted will be asked to Sue. All right, hand over to you, Sue. Thank you.
Thank you. What I'm going to do is the papers that you've had out are really the position of the 12-week assurance plan when it came to an end. So I'm going to pick the salient points out of those papers. But what I want to do also, and I've got just a very few slides. Can we put those on slightly later, Carolyn? If we can, then I'll just take you through a very few slides as to where we are now. So I'll just do the quick overview of what you've got so far. So the papers particularly have reference to COVID and the work that Children's Services is doing through COVID. And it's, I think when COVID first became a reality here, we in Children's Services thought, well, we'll just carry on as normal. We'll still do all of the normal improvement work that we will do. I think the Commissioner, Peter Dwyer, sort of was very clear with us that actually, Sue, COVID will affect the work that you're doing. But actually what we found is we are doing work differently. It has affected some aspects of the improvement plan, but on the other hand, actually, it's given some insights into other pieces of work and generated other pieces of work which we think will safeguard children going forward. And I'll talk a little bit more about that in a minute. So one of the Commissioner's tasks, I want to just make very clear really, is that he was tasked quite unusually with looking at our No Wrong Door project, our Futures for Families project, which is about children on the edge of care. I think really the Department of Education wanted to know was it worth pursuing this with Middlesbrough, given that our practice was judged by Ofsted as inadequate. However, he made a very early recommendation that we were very pleased about, that we should be continuing with that project, and that work is ongoing. But I think it will be a great asset to children and young people in Middlesbrough. Just picking out also that we have a new chair. We have an independent chair now of our improvement board. He's John Pearce, who's the Director of Children's Services in Durham. I think it's his third director's job, so he's very, very experienced. And he's providing us with another sounding board, another wealth of information in terms of, adding richness and clarity to our improvement journey. So that's a really good thing, and we're really valuing his input. As I've said, the immediate assurance plan, what we've also called the 12-week plan, its sort of operational aspect finished on the 31st of March. But you'll see from the papers that we've done some analysis and some assurance around that. I'm not going to go through those papers in detail, but some of the sort of work that progresses from that we'll be able to show, I'll be able to show as we go through the few slides that I've got. One of the questions was about culture. And one of the main vehicles for change that particularly up until sort of mid-April, when the virus stopped some of this work, was our clarity and confidence workshops. Hopefully they did what they said on the tin, as it were. It was about providing clarity in terms of procedures and what, our expectations of social workers, social care workers and their level of practice, but also about confidence. I think that when you are in an authority that is not judged to be providing good practice, that can sap your confidence. So it was about giving social workers that clarity and that confidence about moving forward. And we have still some input on clarity and confidence, but I'll talk about that a little bit later because it is now in the middle of COVID in a slightly different form. What we've done, one of the things that we've done to move on, and it's continuing, one of the main themes, and I know one of the questions also was about challenges, was the way that we work with children who are suffering from neglect. And what we've tended to have is what you might call start again syndrome. So there's a family that, we're concerned about the children. We go out, we do just about enough to get the children, as it were, over the line. We don't provide ongoing support. We are probably overly ambitious about the capacity to change. So it dips again. Out we go. We look at the children. Things improve, but not well enough. And that cumulative effect of neglect, as I'm sure Mark knows, is actually progressively damaging to children. So one of the things that's been really important, but is coming to an end now, and there'll be some analysis following, is that we brought in a team of auditors, and those auditors have been auditing every child on a child protection plan with the subject of neglect. That is for two reasons. One is about if it's that work with those children is not in the right place, let's get it in the right place really quickly. And the other in terms of learning, what are we learning from working with children in neglect? Are we professionally curious enough? Actually, have we looked in the cupboards? Yeah, have we been upstairs and seen what the children are sleeping in? Or have we just gone in and seen a snapshot of what those children's lives are? So that's really been very important. Again, one of the questions has been about challenging culture. It's quite hard, again, when you've had an audit done of one of your pieces of work and an auditor sits beside you and says, this isn't a very good piece of work. How do you bring staff along with you when actually you have to deliver those very difficult messages? But I think this goes back to, and what is continuing now, this high support, supporting social workers, but high challenge too. You can't, to improve, we're not going to be able to have one without the other. And staff have said to us actually, and said to me, individually, so, we feel like we're being done too. So we've tried to do it differently. We've tried actually to do it in a more coaching and mentoring way. But actually, although we can support social workers with workshops, with that coaching and mentoring, we also have to get to the culture of high challenge. Because without that, I'm firmly of the view that practice won't change. One of the things that particularly has we've done through COVID is the government's definition of a vulnerable child, although it's changed slightly recently, is any child with a social worker. About 2,700 for us, varies a little bit up and down. And every child with an education, health and care plan, they all have to have a risk assessment. You have to make sure that they're safe. So what we decided to do here in Middlesbrough was do a safety plan for every single child. That was ambitious. And also in terms of improving through COVID, safety plans were one of the things that Ofsted found nowhere to be seen on our children's files. So we divided children into two cohorts, those children who are on child protection plans, those children who are looked after, but their placements are not yet secure, those children who are home on care orders, and the second cohort who were children in need, but children in need that weren't escalating. So we have done a safety plan on every single child. It's taken slightly longer than I hope it would have done. I would say that the safety plans for children who are on education, health and care plans has been smoother, although the number has been less. So over the last few weeks, we have done a safety plan and we have that's been a tremendous achievement. I would say that the quality of those safety plans has been variable, and we have had to again put some coaching in for staff who again we are returning safety plans as inadequate. What we've also done is audited 20% of those 2,700. That's an enormous amount of audits, but we felt it was necessary to ensure that our plans were of as many of our plans as possible were of a good standard. We've also learned some lessons in terms of sharing safety plans with schools, and also schools are doing their own checks on vulnerable children. So for the first time, we're looking at information recording from schools going on children's social work files. So again, out of the pandemic, many some good aspects of practice have arisen. Also, in terms of keeping in contact with children, we've seen direct work being done over a fence. We've seen socially distanced dog walking, so that going out with children. Some of the ways that that social workers have been interacting with children have been inventive, I would say, and good for the children. And we've managed also to do some softer things, like we had, I think, 1,000 books from the National Reading Trust that we've sent out to children when we've been going out. They included books to read to your bump when you're pregnant, which I thought was really good. We've had games, compendiums of games. We've had Easter eggs, all of those things, because we don't want children to feel that they're forgotten. And I've also, I think it's very, we were talking, Councillor Walker was talking about, you're inside the house and you might feel forgotten. And I think that can happen to children too. So taking out these, things, these creative arts, etc., seem to us to be a very important thing to do. In the pack that you've had also, you will see some of the so what's of having done the 12-week assurance plan. Okay, so we've done some of these actions. What does it, did we make any difference? I think from, so for example, in terms of the work in the match, because of the work we've done around thresholds, because if our thresholds were not in the right place, we know that because of the work that we've done, our thresholds are in a much better place. So we know that children are getting the right help at the right time. So we're working very hard on analysis. And I would say, again, that's a learning curve, not only getting the information, but analysing what's behind it. And I'm sure Mark, perhaps we haven't asked Mark to help us with that as much as we could do, but that's really important. That's so what, and that's so what for children. So if I can focus a little bit on the match. So Caroline, slides, please.
Sorry, Chair, just be a second.
While Caroline's sorting that out, I'll just say to people that when Sue's finished her presentation, we have received questions and they will take over priority, and then I'll ask anyone else who hasn't submitted a question to submit theirs.
One of the questions that we have actually talked about, what's going to happen, after the 12-week plan. So this slide is, and we don't need to read every single line of it, shows you that we RAG rated tasks that were complete, tasks that were on track, and tasks that were overdue. And you can see there that the red, and we did have some red actions at the end of the 12-week assurance plan. And most of that was around the match, the tasks that we put in and the tasks that we were trying to do told us very clearly, or we felt in Children's Services very clearly, that the match which was operating in conjunction with Redcar in Cleveland was not doing what we wanted it to do. So we took a decision on the 9th of April to disaggregate the match from Redcar and Cleveland. So you can see that, you know, although those tasks are red, and, you know, I would hold my hands up to that, when you're taking a decision as significant as disaggregating from a match, you know, your front door to children's services, it's going to alter the way that things happen. So that's the decision that was taken. I think that in some ways, we are working probably better with Redcar in terms of disaggregating than probably we did when things were together, because it's actually much more of a partnership, which is, you know, something I need to unpick about, maybe a shared aim. We didn't just disaggregate the match on our own analysis. The Commissioner, Peter Dwyer, spent time in the match, and what he said to us was, if you want to make the improvements, Sue, at the pace that you want to make them, and you need to make them, you need to disaggregate. It is actually, you could do it without disaggregating, but you haven't got the time. So that's, you know, the sort of rationale behind that. I'm going to take you just very swiftly into some hot off the press, really, aspects of our new improvement plan, the wider improvement plan. So we've got 3 themes, and these will run through all of the work that we're doing from here on in. The first theme is quality of our practice. I don't think that needs much explanation in terms of, you know, our practice needs to improve, and our regulators have told us so. The second theme is our leadership and management. How are we, you know, how are we bringing the service along with us? Have we got the right procedures in place? Are we making sure that, you know, the high support, high challenge culture is there? And our third theme there is governance and partnerships. So they're the 3 themes that will now run through our new improvement plan. It's going to be less clunky than the 12-week one, and some of that's because it's over a longer period of time. Next one. So this again, I'm not looking to you to read everything, but I just wanted to show how we've got an overarching plan, which the diagram that I've just shown you talks about, but then it takes you into a year plan. So I've just taken a snapshot of a page in our year-long plan. And what I've done is I've picked the part of the plan which is about the front door arrangements. So you can see there, and on the left-hand side it says QP3, QP4, 5 and 6. They're the quality of practice, which it would be at the front door, and there's those actions that we didn't complete in the 12-week assurance plan. So you can see that we've picked up all of the actions from the 12-week insurance plan, and we've taken them into the new and wider plan. So I would like to just assure councillors that nothing's been dropped between 2 plans. And you can see that the match is still something that is very important to us. And underneath that, we've put, how are we going to measure that things are right in the match? And what difference does it make to children? Next. One of the things that I know that was a focus for people here was the resource plan. We know that we've got 3.3 million. Principally, the resource plan is about bringing in sort of specialists, as it were, to support us in the improvement journey. But we've been fortunate enough to maximise our resource by combining it with the resource for Future for Families. That's that No Wrong Door project that I talked about that Peter Dwyer said that we could keep. So we've been able to rationalise there. So for example, the project manager, just a quick example, is now project managing both projects. We're of course regularly monitoring the plan in our departmental management team, and it's got its own budget line. I'm bringing together a virtual project team so that we've got people who are more focused on getting papers out on time, making sure that the papers are of a good quality. Some of that isn't as slick yet as I need it to be, so we do need people to do that. We do have staffing recruitment underway. Again, that has been to some effect affected by COVID. And we have had to bring in some agency cover. For example, a social worker in the Children with Disabilities team, personal advisors in the care leavers team. If we hadn't done, we wouldn't have got off the mark as quickly as we needed to, but recruitment is now underway. And also if a post is a specialist in terms of data analytics, then I've put knowledgeable recruitment. And what I mean like that is we're going to get other data analysts to actually recruit those people. So that's in a nutshell how we're looking at the resource plan. And I think there's one more slide, which is chipping away at the culture. You can't change culture overnight. I can sometimes, and change isn't linear. The way that we're doing it is about communication, regular briefings. I'm trying to do vlogs, which is very scary, and I really must do something with my hair. We need to focus on high support and high challenge. I've talked about that. There's also a balance between performance and quality. One of the things that Ofsted criticised us about was that we were too much about compliance. Compliance is a hard word, but actually, you can't, an assessment, if it looks to be a good assessment on the face of it, if it's taken, 90 days to do it, what worth is it? So we've got to get that balance, and we're not quite there yet between counting the days and the quality of the work. Another way that, the clarity and confidence workshops were excellent, absolutely excellent. And some of the follow-up work from that, even for example, World Social Work Day, we've had to pull, and they were all about getting the service together across children's services. And I must emphasize how much children's services is now working together across the piece with, special educational needs and disabilities, working more with schools through our through Rob Brown's part of the directorate, and that's been really good. The other thing that I'm actually very excited about is we're bringing together a centre for practice excellence, and that will be where all the training is contained. That will be where we support our first year social workers. That will be where we do all our auditing or our performance management. So it will be probably a virtual team, but we've scoped it out already in terms of this will be the engine room for improving our quality and practice. I've talked about code, practice framework, expectations. Actually, if you expect good practice and you set that tone and you role model. And the last thing I've got on there is partnership. Partnership corporately, and Children's Services does need to learn to be a more corporate directorate. Partnerships and partnerships across Children's Services, and partnerships with wider agencies working with children. I think that's it for the slides. Yeah, that'll do. Okay, so that's a quick run through, and I hope not too much too fast, but there's a lot to say, and I'm actually very excited about it all. So happy to hear what you have to say.
Thank you for that so much, Chair. I did have two questions for you. One was like, how are we progressing against the improvement plan? But I think you've already covered that, so I don't need you to ask that question. My other question is there a commitment to retaining the service in-house?
Absolutely. That's what we've been working towards in the last, since the inspectors left the building, really. And that's one reason why we put we slapped the 12-week improvement plan in as soon as we possibly could. The Commissioner liked the fact that we got off the block as quickly as we possibly could. So there is an absolute commitment. The Commissioner also didn't come with an assumption, we thought he would, but he didn't come with an assumption that we would go, that it would be a trust unless we proved otherwise. He was really genuine and fairly looking at it. So I can assure you that there is an absolute confidence for the council, in absolute intention for the council to retain its services.
Thank you for that. The next question is from Councillor Halawi. Would you like to answer? I think you've got two questions, Councillor Harawi. Would you like to answer them? And
Thank you, Chair. You may have touched on an answer in part, Sue, when you talked about working with Redcar and Cleveland and the match issues. Because when I read in your report that the issues about working with Redcar and Cleveland has resulted in some key challenges, and that Middlesbrough's lack of direct control has led to greater challenge and dialogues with different thresholds, different vulnerabilities, that really sort of startled me. And I thought, this must be really worrying that, you know, on top of coping with all the other challenges within Middlesbrough, we've now got the external challenge of working together in partnership when we're not singing from the basic same hymn sheet. I think that's what I understood from what you'd written. So given that you've mentioned now how we've disaggregated to some extent then with the match ideas, and that was on the advice, I think, which was very timely, of Peter Dwyer, are there any other lingering challenges and different differentials in thresholds that are still causing us concern? Have we any ways of getting around them, or should we feel a little bit more comfortable now?
I think you should feel more comfortable now. We did some audits of our work at the front door, quite successful audits that, you know, really did evidence that our thresholds were in the right place. Yeah. We have had some good conversations with Redcar around, you know, none of this is, you know, well, this is all, been very, we've learned from this too. But I think you should feel assured that the work around the front door is going well. We had a sort of test run when Redcar had their cyber attack, and we brought the match here into Middlesbrough, and that worked very well because they were very close to our assessment service. So that really gave us some confidence that we were making the right decision.
Okay, thank you. That's reassuring. Thank you.
do you want to come back on that, Councillor Howie?
No, I'm reassured, thank you, but I was concerned when I read that in the report. And my other question is on a similar note, really. It's the association of working with Stockton on the issue of the PACE beds, the PACE beds, and the protocols around supporting and approaching children being held in police custody. So there were differences, were there not, within the emergency duty team in Stockton. And I think that seemed to pose a problem from what you wrote. And I just wondered if those issues had also been resolved.
I think in some ways the problem wasn't so much differences between the EDT, which covers, you know, 5 authorities. It was more probably around the fact that they're around at night time when these issues arise. You know, because, you know, if you're keeping children in cells overnight, that's EDT that are going to be dealing with it. But our youth offending service, head of service, has formed a group with the police and with EDT representation to look at how we can prevent this happening. Does mean you've got to have placements, you know, on hand really quite quickly. I'm not saying that this is absolutely resolved yet, but I can do a briefing on more from that, Councillor Howie, if you think it would be useful. But certainly in terms of working together with EDT and making them more aware of the issues has helped.
Thank you.
Come back on that, Councillor Howie.
Thank you. Yes, I'd be grateful for any further information that you think would be useful and relevant to us to know, so that we can just keep an overview of all the different contexts that we're facing and where the challenges are in particular. Could I ask my last question, Councillor Thompson?
Yeah.
Thank you. It's about the NFA contact referrals. You said there'd been a reduction, your report mentioned, in NFA referrals from 17% in November 2019 to 2% in March 2020. Could you give us a bit of insight into those quite different figures, please?
Okay. These are referrals that come in and they're looked at. So a contact, somebody contacting us, is seen to be at the appropriate level to become a referral. And what we were finding really that too many referrals coming in weren't going anywhere. So we were not so asking. So that sort of shows that threshold because if you've got 17% of a decision not in the right place, so you're looking at referral and you're standing it down. I would say from the figures in the report that 2% is probably now a bit too low. We've got to find that ground, because you've got to have room for decision making. So we need to get to a stage, and we have moved on since you've read the reports, but I don't have the actual figure in my head, which is around, where is the balance? So you've got a referral, where is that threshold? Is it right now? Do we need to tweak it up, tweak it down? We need to keep looking at our thresholds and keep making sure they're in the right place. 17% was too high, 2% probably a bit too low. So let's just get it more in the middle.
Okay.
Councillor Halawi, would you like to come back on that?
No, thank you. I feel that I understand better now, but it just does seem a stark difference from 17% to 2%.
It is a stark difference, you're right. Yeah.
Yes. The next question is from Councillor Odin.
Yeah, thank you. Thank you, Chair. Yeah, obviously the Sue's report was fantastic. I think she covered quite a lot of this. My question as well. My question is, I was reading some paper about the local government information unit, and what they're saying, some of the social workers are predicting an increase in referrals of vulnerable children as soon as they return to school. So therefore, obviously the question arises, but again, as I said, partly Sue answered as well, some of them. What plans are in place to address the potential surge in referral once our vulnerable children return to school? Further, information regarding the partner agencies. For example, what are they? Do we know them? And what sort of skills, knowledge, experience they have? And part of my question is whether there is a role for ward councillors to sort of assist if needed.
Okay, I think it's a question that is a hot topic, and it's one that we're looking at. We do have a group called it's just called Safeguarding Briefing at the moment, so nothing fancy, and we have health, senior representation from health, from the police, from Redcar in Cleveland, and from us, because we have a safeguarding arrangements with Redcar in Cleveland. And we've been looking really carefully at what might happen. And again, Mark may be able to supplement this question. But what we found in some of our statistics more recently is that drop is actually beginning to even out a little bit. We did have a big drop in contacts. The police did have quite a big drop in referrals for domestic abuse. But what we found more recently is that's levelling out. Now, whether that means that, people are going into some sort of COVID normal and things are beginning to, referrals, etc. So we are keeping a very close eye on that. I would say that children returning to school is something that schools are addressing very seriously, but they're not going back all at one time. So you're not going to get a full school, as it were. You're going to have school groups, and at the moment it seems to be year 6 and year 1. So, and they're going to be, socially distanced. There's going to be different walkways, all of those things. So I think the schools with their in-depth health assessments and not all of the year groups, going back at once, that will be able to, gradually look at where the problem might arise. I think further information from the Partners Council working on this. In terms of the recovery group that Tony and colleagues talked about, we do have a children's services social care recovery group. So we are looking at all of those issues through that mechanism. Is there a ward for ward councillors? There is always a role for ward councillors. If you see something and you're worried about it, refer it. Yeah. If people are saying, oh, I don't want to worry social workers because they must be really busy, say, get it in, refer it. If in doubt, refer it and we'll look at it. Don't say, oh, wait a couple of weeks. Don't say, maybe they are busy, don't worry. Just say to people, refer. And that is absolutely the right way to protect children.
Councillor Odin, would you like to come back on that?
Yeah, thank you for the information. Yeah, it's real. I mean, it is concerning, obviously. Yeah, but as you're saying, the local obviously councillors could report and could obviously be put a referral in and so on. So I think that really assuring as well that people could take that on. So
don't delay. No.
Yeah. Okay. Thank you very much. Thanks.
Well, that's all the questions that's been submitted, but I am prepared to take some more. Only if you're going to ask a question, can you raise your hand so I can see? I'm not sure whether Councillor Wilson wanted to come in. Did you have a question, Councillor Wilson?
Yeah, just one there, Chair. Regarding the no wrong door on Spencer Hill Crescent, how far back's that been set so with this COVID?
We did, the main setback really was contractors on site. But now that sort of has been eased, we're looking at September. So yes, some delay, but some delay, but actually September, but as soon as we possibly can, now the contractors are back on site.
Are you happy with that, Councillor Wilson?
Yeah, that's fine, Chair. Thank you.
Can I ask Councillor Coope, did you want to speak?
Yes, thanks, Chair. I just wondered how successful the homeschooling was across the schools, because obviously that's an important part to keep children not only safe, but also part of their futures. I just wondered how that is planning and what future planning you're going to have to make sure that if you need to stick to it in September or need to come back to it, that the processes are all in place.
I think that teachers, schools have worked tremendously hard to ensure that children are getting an education. I think around home packs, around advising parents, I mean, around, that are looked after children. Virtual School, for example, has put together learning packs, with stationery and things like that to encourage children to learn to draw, all of those things. We've put competitions in, for example, around Roald Dahl, because that actually gets people drawing, writing, thinking. So we've done from the council, but also, I can't fault the schools for as much as they've done. And it is very time intensive for them. I think the other thing is that, it does put a lot of pressure on a family, in terms of, getting a child to sit behind a desk in their home environment, for example, not for every family, but for some. So I know that, some advice has been, look, let's not make it formal education. And my favourite phrase now is, let's talk about education by stealth. Do some cooking with them, do some gardening with them, read stories, go out and, I'm running out of ideas, but all of those things really, that education by stealth, weighing things, measuring things, all of that, can be as educative and keep young minds alive as we possibly can. So it's challenging, but I can see it happening, and we're trying to support it as much as we can. And I would like to mention to our virtual school, if we looked after children, I think they are going above and beyond to help to educate our most vulnerable children.
Councillor Coope, would you like to come back on that?
Yes, thank you. No, that covers most of the points, but I was just concerned we have a lot of children in parts of Middlesbrough, quite across the town, where they may have a large family. It's more difficult to get some children involved when other children may not want to get them involved and things like that. Finding a quiet place for them to study, because it really is important for their future as well as the town to make sure they have a good education. I mean, especially children coming up to exams in this year or coming up to school places. We want them to succeed. We want to be a successful town. And I worry that this is going to be a big challenge for us.
Any more questions? Councillor Halawi? Councillor Halawi, you haven't got your mic on.
Thank you. Sorry, thank you for that. Another point in the report too, where you mentioned that of the total vulnerable children, 2,905, the average weekly attendance is at 4.6. So that's about 1 in 20, isn't it? And, you know, they're the vulnerable children. I got really worried about that and thought, is that the case? I mean, I know, as you said, that schools, I'm personally aware of schools, they're going the extra mile to visit homes to try and get children to come. But when I thought these children are vulnerable and only 1 in 20 of them is coming to school at the moment, I really began to worry quite seriously there.
It's risen now sort of 9, 10, 11%, depending on the day. So it has gone up. It's been something that we've discussed lots of times, really, because, you know, parents are naturally anxious. I mean, Mark, we can talk more about, you know, the likelihood of children, maybe the resistance of children in terms of infection. But some families are very worried and very scared, particularly if they've got vulnerable people at home. We've looked at whether we should write to parents, and indeed some local authorities have. But you know, attendance is voluntary, so there's no teeth there. We've looked at even probably more serious ways of doing it, like, for example, if we've got families that we're really thinking about going to court on, should we write to their solicitors and say these children should go to school? But again, you know, where do you go with that? How much pressure do you put on families? So what we've been doing really, certainly children not being in school has been part of the safety plans. We've also, when social workers will visit homes, they will, you know, talk to parents about why aren't your children in school, and they will record that and take that into account in terms of safety. And we've made that very clear, and about working in partnership with schools. So it's a challenge, and I can't pretend that's not a challenge. And I would like to see more vulnerable children in school. I suppose the other thing I would say about vulnerable children is that children with a social worker are vulnerable children. However, some children have been in their foster placement for 10, 12, maybe 13 years, for a very long time. And, you know, they've got a successful placement, they've got a forever home. How vulnerable is that in terms of having a social worker? And there are probably, you know, and then so I think it's, you know, there's vulnerable, and I hate to, is it right to say there's vulnerable and vulnerable, you know? So that's where we are with it, but I can't say that it's not challenging.
Councillor Halawi, do you want to come back on that?
Yes, thank you. I suppose in the context of the total children on school roll, 24,636, there's only 1.24% of them attending school. I mean, that's quite shocking as well, isn't it? For different reasons. And again, very worrying in a different context. I think we're all really concerned about children who aren't accessing education, and that reflects the position in Middlesbrough, where I think we possibly particularly susceptible, because I think nationally the figures are higher.
Councillor Ardern.
Yeah, thanks, Chair. Yeah, the question I'd just like to ask, obviously, I know children are going back, hopefully, sometime in June, beginning or middle. We have obviously the duty towards the children, and it's like the children's well-being is the paramount. At the same time, we have a duty towards our teachers and the staff. So do we feel they are able to manage and they are equipped with, say, PPE or whatever safety measures and so on? So that's just a bit, you know, I'm a bit concerned, a bit worried as well. So it's welfare of our family, you know, obviously they are teachers, they got families, they got to go back to families and so on, you know.
I think that's an absolutely relevant point, I think. And teachers themselves may have, you know, underlying health conditions, which puts them in this, you know, the sort of like very vulnerable shielding position, as it were. I think schools are doing in-depth, you know, health and safety checks, which we're supporting them to do. I think there's some very quite innovative ways of staggering break times, staggering lunch times, having smaller classes, distancing desks, providing teachers with the appropriate PPE. So I think there's, you know, I think that there's a lot of work going into keeping not only children but teachers safe. And I think that, you know, head teachers are taking all of that into account in terms of their assessments, and have they got the staff to teach the children that they've got. So we've been doing quite a lot of, well, and Rob Brown particularly has been liaising with schools. And it's also about opening when they're ready, you know, not, you know, maybe it's the 9th of June, but it feels safer, you know, also, you know, another example is a school being open for 2 days, closed for 1 day for a huge deep clean, and then open for the next 2 days. So there's a lot of, you know, ways that schools, and I'm very proud of them for doing it, are looking at keeping everybody safe.
Any more questions? Councillor Halawi?
Yes, it's in terms of the guidance from the local authorities to schools about opening. And I think, is it not right to say that the schools have put the onus, the authorities put the onus on the schools to make their decisions about what to do and how to do it? That's quite different from other local authorities. I know there are 5 in the north there, which have made very clear decisions from the local authority and expected the schools to adhere to that. I think one of the downsides of delegating responsibilities to the schools really is that it puts a massive responsibility on the shoulders of specific head teachers. And I think that must be quite difficult for them to have to deal with, to think that that decision is theirs and that comes onto their shoulders, the outcomes of what might happen as a result of their decisions.
I think I would challenge back slightly and say that I don't think we've put the onus on. I think we've tried to support. If you look at Academy, for example, we can't tell them when to go back or not. They will make their own decisions. And I know that there's one Academy chain that is making that decision for themselves to go back on the 1st of June. You know, schools are run by governors. Yes, ultimately the responsibility is theirs. But we feel very strongly that you know, a one size fits all is not it. It has to be what the school, what the head teacher thinks is best for the children in that school. And I think it would not be appropriate for the local authority to say, no one's going back or you're all going back. So I think we should guide, we should support, we should make sure the equipment's in place, for example. But, you know, it has to be. It's much better for the schools to make their own individual decisions based on their own circumstances than for the local authority, if indeed we could do it, to say, you're going back on Tuesday.
Right. Any more questions? Councillor Cope?
Yes, thanks, Chair. One thing that then brings to mind is about transport, etc. To take the schools back. I know it's in the hands of the school, but not only transport will have to be arranged, but encouraging the children themselves to socially distance on the way to school might prove an impossibility.
I take your comment. Yes, I know that school transport is something that is the responsibility of the local authority. I mean, it's something that I know we are looking at. I don't have any more details in my head than that. I think socially distancing is you know is something that we should be encouraging children to do. I mean, year 6 is going back into school. They probably have a better idea of social distancing than maybe, you know, different year groups. But yeah, I think I can't disagree with what you're saying.
Sorry, if I can just add to that, it's Tony. We're very aware of that, Councillor Coop, and Sheffield is ready and waiting. Once we understand which schools are opening when and which children are going to attend those schools, that we have the responsibility for transportation, then undoubtedly we will need to change our transportation. Even if you look at buses at the moment, for example, a single-decker bus, the recommendations from government are that they carry no more than 10 people, a double-decker 20. That is going to stretch us. We'll have to look at how we can respond to it, and it is going to be an additional cost that we will reflect in our submission to government on the direct cost of COVID.
Any more questions? Right, if everyone's asked no questions, can I just thank our guest speakers? So I don't know whether you want to come back or add anything else.
No, thank you, and thank you for the questions. And I hope that information has been useful.
I think it's been very useful. All the presentations tonight have been very useful through the COVID and the Children's Services update. We have been sent very comprehensive information and through an email, which I think there was about 104 pages sent, which took me 2 days to read. But yeah, want to thank us all once again. So if everyone's happy with that, we'll go back to the agenda. Right. The next thing on the agenda is the scrutiny chairs updates. Can I just say, like, if you want to go, that's fine. You don't have to stay. Okay, thank you. Right, we've got the chairs updates. Unfortunately, we've not got Councillor McTighe because she's left the meeting before it started, so there's no update. Right, we'll take on Councillor Saunders. Can you give us yours? You haven't got your mic on, Councillor Saunders.
Yeah, you got hear now, yeah? Yeah, fine, yeah, thanks. Yeah. Yeah, the EDEI scrutiny panel met on the 14th of May. And the members of the Economic Development Scrutiny panel met virtually and received a detailed update from Jeff Field, Director of the Environment and Commercial Services. Jeff provided information about his services response to COVID-19 in the following areas: refuge collection, green waste collection, Havant Hill Recycling Centre, grass cutting, community safety, provision of temporary mortuaries, public and school transport. Regarding the budget, including the loss of income to the council, as well as any additional expenditure and highway maintenance. On that point, can I say, if you want any questions answering, if you could email Jeff Field, I'm sure he'd give you a detailed answer. The focus is now on recovery, and the plan and how services can operate safely and effectively as lockdown restrictions are relaxed. It was highlighted that the contributions to both staff and management to respond to the pandemic has been impressive and truly demonstrated what a committed workforce the council has. Our next virtual meeting will be held on Thursday, the 4th of June. Richard Horniman, Director of Regeneration, agreed to attend the informal meeting to update on his service area. That's it, Chair.
Thank you. Have you got a time for that, Councillor Saunders?
Sorry, Chair, yeah, it's 11 o'clock on Thursday, the 4th of June.
Thank you. Anyone want to ask Councillor Saunders any questions? Thank you. Right, we can't go to Councillor McIntyre because he hasn't turned up. We've had no apology, so we can't get an update of the culture and communities. So now I'll go to Councillor Platt. You've got 2 to report on. Would you like to give us your report, Councillor Platt? You haven't got your mic on.
Yes, first of all, the children and young people's learning. Before the lockdown, the Children and Young People's Learning Scrutiny Panel was undertaking an investigation into addressing poverty issues and the impact on learning. We were due to receive evidence from a number of head teachers on the effective school-based practices, etc. We will continue with this investigation when the crisis is over, and a final report will then be drafted.
Thank you for that. When's your next meeting?
It hasn't been arranged yet.
Right. Want to give us the update on the other scrutiny?
Update on the adult social care and services scrutiny panel. We are currently undertaking investigation entitled Physical Activity for Older People aged 65 plus. The panel had been due to consider the contents of the draft final report at the last meeting and agree conclusions and recommendations for submission to the executive. This meeting was scheduled to be held on the 18th of March. However, due to the outbreak of COVID-19, the meeting did not go ahead. It is envisaged that the scrutiny panel will continue with this investigation once the crisis is over. Again, we have no date for our next meeting.
So you are doing virtual meetings?
I personally would like to get back into the council chamber, and I think that it might be an issue for us to get into it now that the restrictions are lifted a little bit.
All right, thank you for that. Councillor Garvey has put his, oh, hang on. Councillor Halawi, isn't it? First.
Yes, I'll put my microphone on. Could I please ask that we do have virtual meetings, because I'd very much like to be informed as far as possible about any new developments. And I think that saying we need to wait till we go to the council chamber, it could make it too long in the future. We've already lost time in scrutiny panel time. So I would really appreciate, please, if we could reconsider and go to virtual meetings, because I really want to catch up on what I feel I've been not finding out about. So I'd make a plea for virtual meetings.
Thank you for that. Councillor Higgins.
Thank you, Chair. I also think there should be virtual meetings. Other scrutiny panels, as we've just heard, are having meetings like that. So it's too long to wait. According to the chair, he's not opening the county, he's not having a meeting until next May. And sorry,
Leave that one, Councillor Higgins, because you want to raise that under any other business.
Yes, I know. Yeah.
Thank you.
I just wanted to say, should have had our scrutiny panel could have had virtual meetings.
I'm sure Jim will take what Councillor Halawi and Councillor Higgins have said on board. Right, Councillor Saunders, did you want to come in? Your mic's not on.
Okay, yeah, I'd just like to say how important these virtual meetings are. We've only had the one up to now. I'm sure Councillor Story might agree with me. It was very detailed. It was only scheduled for 30 minutes, but we went over the hour. I think through this COVID-19 crisis and the recovery plan, scrutiny panels will really do and need to do an important job in this term and possibly years to come. Thanks, Chair.
Thanks for that comment, Councillor Saunders. We go to Councillor Higgins.
Yes, Councillor Saunders, can you pass my regards to the environment? All the workers in that environment, they've done an absolutely fabulous job, and a big thank you from me, and I'm sure all the other councillors. And yes, I should have said it earlier, but I didn't get my hand up quick enough.
I totally take that on board, Teresa. Yeah, I will pass them on.
Thank you.
Councillor O'Dane, did you want to ask a question? Yeah, I haven't switched your mic off. Councillor O'Dane, did you want to ask a question?
No, at this point, on any other business, if I could.
All right, then. Councillor Coop, did you want to ask a question?
Well, I just wanted to mention, Jeff Health Scrutiny Panel, I just want to add to this that I'm hopeful that Health Scrutiny Panel again very shortly, as along with other panels, virtual, whatever, are to go ahead as soon as possible.
Thank you for that. Any more questions? All right, well, thank you for the update for the chairs. Oh, sorry, I've missed out. Councillor Garvey's not here, so I believe Joe Dixon's going to give us a report on behalf of Councillor Garvey.
Hi, Chair. Yeah, thank you for that. Councillor Garvey unfortunately couldn't make today's meeting, so he's just asked me to pass on the following update. So the Children's Social Care and Services Scrutiny Panel last met on the 9th of March and received an update in relation to a previous review on kinship carers. That review had been undertaken by the former Children and Learning Scrutiny Panel. In the period between that meeting and today's meeting of OSB, as an interim measure, following discussion with the Chair of Corporate Parenting Board, with the Chair of the Scrutiny Panel, it was felt that it was appropriate for a written update to be provided to members regarding the progress on the Children's Services Ofsted Improvement Plan. As the all-member briefing on the same issue had also had to be cancelled due to the COVID outbreak, the Deputy Mayor felt it was appropriate for that briefing to be circulated to all members, and accordingly an update was circulated on the 8th of April this year. Members had the opportunity to submit questions and comments in relation to that update, and those questions were responded to by the Director of Children's Services and circulated to all members on the 30th of April, and the chair has asked for a further written update to be provided by the director on the same subject.
Thank you for that. Any questions? Well, thank you to the chairs and the substitute chairs for stepping in and giving us an update. Much appreciated. The next agenda item is any other urgent items, which in the opinion of the chair may be considered. I have had 2 questions submitted, and I am prepared to take the 2 questions that's been submitted. The first question that's been submitted is from Councillor Halawi. Councillor Halawi, do you want to take it?
Yes, thanks. Today has been a really good example of overlapping areas amongst different scrutiny panels and other committees and boards of the council. And the last section that we've just listened to now has been the feedback from the chairs of the different scrutiny panels to this overview and scrutiny board. And I was looking as chair of corporate parenting for a mechanism to feed back some of the issues that are raised in corporate parenting to the Overview and Scrutiny Board. And I know, Charlotte, you probably know within the Constitution and the governance of the way the boards and scrutiny panels and committees work together. And I know there's a certain hierarchy there about the processing of information and the sharing of information. But I'd really like to think that we could have a mechanism, if possible, for me to feed back to the Overview and Scrutiny Board some of the pertinent points that have been discussed and raised in the Corporate Parenting Board.
Charlotte, do you want to answer that?
Thanks, Chair. I think this needs further discussion, but the Corporate Parenting Board isn't part of the council scrutiny arrangements because it's a council committee. Can I suggest that there are discussions outside of this meeting yes, with Councillor High and with Sue Butcher about any reporting arrangements?
Yeah, that's fine.
With that answer, Councillor Hallam.
I look forward to a response. Thank you, Charlotte. We'll get together and see what we can do on that. Thank you.
Right. The next question I've got is from Councillor Higgins. Would you like to ask your question, Councillor Higgins?
Yes, please, Chair. Well, could we please have some discussion on why we can't have a full council meeting? I feel I've had no input in the council's business since the lockdown, and surely we should have some people in the chamber and other people having a virtual meeting. I can't see any point in not having a full council meeting.
Charlotte, would you like to respond to that? Charlotte? Charlotte?
Was the answer.
Sorry?
I said silence was the answer.
Charlotte, is there a technical issue, Scott?
Joe, I lost my connection slightly there where when Councillor Higgins was asking the question, but I have seen the question in writing, so I can try to answer it. I'm not sure whether you can hear me at your end, though.
Yeah, we can hear you now. Now we've lost you, Charlotte. Can we get her back, Scott? Because Charlotte or not?
Chair, it's Tony. If Charlotte remains disconnected, I did discuss this question with Charlotte earlier on today, so I might be able to provide some form of response. Not as
appreciate that, Tony, if you can, yeah.
Yeah. So I discussed this with Charlotte, and basically the decision around whether or not to hold a council meeting within the Constitution is a decision of the chair, and that decision has been made by the chair. That being said, the Constitution does allow for a debate on that decision should any group of 5 or more members which wish to seek an extraordinary council meeting to debate whether or not to have an AGM or any other council meeting so that a vote can take place on it. So if any group wanted to have a discussion on that, then that would be the route.
Does anyone want to raise their hand? Councillor Storey, do you want to come in on that?
Yeah, thanks, Chair. I'd say that I think I told Councillor Higgins, the quicker we can have full council meetings, I think the better. I think it makes backbenchers who aren't executive members feel as though they've got a role to play in discussions, and it also shows the general public that we're taking up our roles at a time when we are telling children that we expect them to go back to school, and teachers and others and workers across the town are going back to work in certain areas where they haven't previously during the lockdown. I think it's incumbent upon us to perform our role as best we can, and that does involve full council meetings. I'm disappointed the chair's taken the decision he has, but just for elected members' information, I have made representations to the chair of the council to ask him to reconsider. I have also made representations to other political groups to ask them if they would support the Labour councillors in trying to get some meetings up and running again. And I would advise any councillors who are interested or are keen for full council meetings to start again, if they want to contact me, it is the settled position of the Labour group that the quicker we can get that job done, the better. So if we can work cross-party on this and get full council meetings up and running, I think it'll perform an important service for the town and show people that we are getting back to doing the work that we're supposed to do as elected members.
Anyone else want to comment on that?
Chair, could I comment? I'm back now. I did hear some of Tony's response and just wanted to add to that where there is council business to be considered or matters that would normally go to full council, we obviously have the Corporate Affairs and Audit Committee, which can make decisions instead of full council, and we've used that forum and we will be for the next few weeks. We are keeping the position under review. Obviously, from an officer point of view, we're thinking about the technicalities, the practicalities of virtual meetings, and by and large, they're going very well, and we're moving towards bigger meetings. So we're keeping the situation very firmly under review with the chair of the council in terms of working towards those bigger meetings. And I'm in regular discussions with the chair about how we will do that. So please be assured that there is an ongoing dialogue about the matter. We've not simply left it till next year.
Councillor Higgins? Councillor Higgins, you have your mic on.
Yeah, your mic's on.
Councillor Higgins, did you want to speak?
Yes, please.
Heard.
I don't think it's right that just a few people are included in what's happening within the town. The mayor always says that everything has to be open and transparent. Well, I think this is one of the ways that it can be. So let us all be included. And hopefully we can move forward in joint, like cross-party decisions, which it would be best for the town.
Charlotte, do you want to come on that?
Well, as Tony was saying, there's always the opportunity, Councillor Higgins, if you do want to have a matter debated, to ask for an extraordinary council meeting, and obviously the council has to consider that matter. So, I think that's all I can say at this point in time, and to reiterate really that we're working towards having those bigger meetings and making them effective.
Councillor Story?
Yeah, I just point out for the record that Corporate Affairs and Audit decisions, as Charlotte says, but it's a committee that has 7 members. There are 46 elected members in Middlesbrough plus the mayor, and I don't think that a body of 7 elected members should be making significant decisions or being a body that takes decisions of that nature. I think we should be looking to get full council up and running because that's a much more representative body. I also think that the technology aspect is a bit of a red herring. I think we've seen today with this meeting, this is a relatively large meeting and it's worked very well. I think the technology's been reliable. I think it's been very well managed by officers. I'd like to thank them for everything that they've done. And I think this proves that we can handle meetings like this. One other thing that I would say is that other local authorities are looking at hybrid meetings in light of the fact that the lockdown has been eased to an extent. Some local authorities are talking about councillors that can attend in person, potentially attend whilst socially distancing in the chamber, and then other members who perhaps can't access the meeting remotely, which would reduce the requirement to use technology to a large extent. And finally, extraordinary general meeting is obviously an option. It's something that Tony and Charlotte have referenced. I think that is something that should be considered, but we also need to consider that in order for any decision to be taken there would need to be 24 councillors in favour. There are 20 Labour councillors, and I'm sure other people in the room can do the mathematics on that. So if people are keen for full council meetings to happen, then I think there is a means of getting that done. And I would welcome any submissions in private via email or correspondence to myself on that point.
Charlotte, do you want to answer that, or do you want to email him?
I think they're all valid points, Chair, that Councillor Story makes, and to a great extent these are political points really, and as officers all we can do is try and facilitate the democratic process in practical terms as far as we can.
Councillor Coop, do you want to come in?
Yes, thank you, Chair. As I understand it, was only the AGM that's been cancelled because the government gave a thing out to allow that to happen. I don't think the Chair will be against actually having council meetings, so I tend to agree with other councillors regarding that. As to the idea of a hybrid meeting, I did actually suggest that to an officer, and I was told it would be technically very difficult due to having cameras, etc., etc. So personally, I wouldn't be against that, but I think we need to know the technical side of it, and I'd be quite happy to come into the chamber and attend a meeting, and I do agree we need to get some council meetings as soon as possible. So let's see if we can get that done, Chair.
Thank you. I'm going to take one more question on this because I think we've debated it quite a lot, which is Councillor Teresa Higgins. Would you like to speak? This is the last.
Chair, just to say that why I put that question in is that we all want to do what's best for Middlesbrough. It's not a political point I'm trying to make. It's a point that I think that the whole council should be making decisions across the board, cross-party, for the people of Middlesbrough. So I wouldn't like, at the end of this, for somebody to come out and say, well, we're only trying to make a political point. And I would ask my colleagues in the other parties, because I do class them as colleagues, because we all want the same thing, to seriously think about Councillor Story's suggestion. Okay, thank you.
Thank you for that, Teresa. Can I just remind everybody that Overview and Scrutiny Board is a non-political board. It's made up of all representatives from all parties. So that concludes the, well, it depends what it's about, Chris, because we don't do any other business. So I'm aware that them 2 questions were submitted, but as long as it's quick and brief, I'll take your question, Chris Cook.
Incredibly quick, I promise. I should have brought up earlier, the lack of representation from the cultures and community scrutiny is something that really concerns me. That when we've got people being locked in all day and not being able to really get out like they normally do, we're seeing community tensions rise. And that was actually something that they were discussing as part of their remit. So if we can't get the chair, can we at least appeal to one of the other members of that committee to try and get an update?
I think that's a fair point, Chris, that, you know, we were relying on Chris, Councillor McIntyre, to come along and give us an update or submit a written one, or to ask his officer if they could stand in, you know, like Councillor Garvey did. Councillor Garvey had asked Jo if she would report on that. I think that's a fair point, yeah. Right, Councillor Dodds, can you be quick? You haven't got your mic on.
Now, yes. I would just like to say that originally I was so scared of these virtual meetings, and being like a pretty new councillor, and because of my age, I wouldn't like to have to go into the chamber. But I do think that we should be continuing to definitely have the scrutiny panel meetings, because I feel as though we need the continuity. We're losing out, we're not moving forward, especially with children's services and the education. And I do think that we could have full council meetings. Now I've seen how it works, and this has been fine today. I mean, I think we all agree that it's been a good meeting and I've enjoyed it. So
Thanks for that, Councillor Dodds. I just wondered if any of the officers wanted to come back on anything. Charlotte or Tony, anyone want to come back?
No, you know, from the chief executive's perspective, more than happy for political involvement in our business. You know, I've said on a number of occasions, the officers are not the council. You are. We're merely officers of the council. So, you know, I would personally support any mechanism that would enable us to conduct the full council business.
Thank you for that, Tony. Anyone else? Charlotte, no?
I think all the comments have been really helpful, and I'm really pleased at the way in which this meeting's gone, save for my dropping out of it. But I think Democratic Services have done an amazing job in getting these virtual meetings up and running, developing confidence, being sure of the technology, live streaming meetings. I think there's still some more work to do, building up towards a full council meeting, and I take on board all the points, and I just want to assure you that I will have further discussions with the chair of the council about this. It's a moving feast, really. It's a dynamic process, obviously, as we get used to virtual meetings. I've taken on board the points about hybrid meetings. It's something we're thinking about anyway, so yeah, please be assured that we're working on things behind the scenes every day. We're making progress, and I think it's really positive.
I'd like to thank all the officers for attending the meeting today. I'd like to thank our guest speakers, and particularly like to thank Scott, who we had a bit of a technical issue to begin with, who's resolved it, and the meeting's gone perfect. So, and I'd like to thank Children's Social Care Scrutiny Panel who's come along today, but also the OSB. I'd like to thank you all for your attendance. What I would just like to say is, if you've been watching on Facebook, I hope you have been able to get an insight into how scrutiny works and the importance of this board. Thank you very much, and good night, everybody.
Good night.